Hi guys, welcome back to my channel. So today we'll be doing the topic that is very important and a lot of questions are asked every year, that is immunization. So let us go through it very quickly, right? So passive immunization is nothing but the toxoids or the immunoglobulins like the diphtheria toxoid, tetanus toxoid, gas gangrene, botulinum, right? And rabies immunoglobulin. Then the human immunoglobulin, they can be either human or non-human immunoglobulins. So just remember the non-human immunoglobulins, which are diphtheria, rabies, and clostridia. Then talking about the types of vaccines, so they can either be live vaccines, killed, subunit, and mixed. Right? The mnemonic to remember the live vaccines are the crime boy, where T is for typhoid, right? That is TY21A. C is for chickenpox vaccine, R is for rubella vaccine, I for influenza, M for measles and mumps, E for endemic typhus, B for BCG, O for OPV, that is the sabin, and Y for yellow fever. Remember that the immunity of yellow fever starts from 10 days and it lasts for lifetime. Then kill vaccines, they are less efficacious. What are some important kill vaccines? IPV, influenza, JE, hepatitis B, rabies, then typhoid, cholera, meningococcal. Right? Subunit vaccines, they are cellular fractions like toxoids of TT, DT, anthrax, proteins like APDT, influenza, and recombinant vaccines like hepatitis B and C, HPV, and toxin B. Then they can be either a polysaccharide or a conjugate, right? So in polysaccharide, the antibodies are formed against the capsule, like we studied in micro, the encapsulated organisms like H. influenza B, meningococcus, and pneumococcus. Then mixed vaccines, they are mixed together, like given together, like MMR, right? Which is given in the schedule DPT, Penta, that consists of DPT, HIB, and Hep B. Then freeze-dried vaccines, they contains the powder and it needs to be reconstituted, like BCG is reconstituted with a normal saline and measles with distilled water, right? M, if you reverse it, it is W. So remember, measles is reconstituted with distilled water. Then JE with phosphate buffer and yellow fevers. So open vial policy is not applicable for these vaccines. That is, they should be used within 2 to 6 hours while open. Yellow fever, it should be used within 30 minutes only. Then let's talk about the national immunization schedule, right? So the current is intensified mission in the Dhanush, in which 12 vaccine preventable diseases are covered. That includes TB, polio, right? Hep B, diphtheria, pertussis, tetanus, Haemophilus influenza, then measles, rubella, Japanese encephalitis, pneumococcus, and rotavirus. Japanese encephalitis and pneumococcal are only implemented in the selected states. Then let us see the schedule quickly. So at birth, BCG, birth dose, OPV 0 dose, and Hep B is given. Remember that the birth dose of Hep B can be given only up to 24 hours, right? BCG is given up to 1 year, and OPV 0 dose is given up till 15 days. Then at 6th and 14 weeks, first, second, third dose of OPV and Penta is given. Penta can be given up to 1 year. Then other that are given are the first, second, third dose of Rota, then fractionated IPV at 6 and 14 weeks, and pneumococcal vaccine at 6 and 14 weeks. These vaccines, that is rotavirus, fractionated IPV, and PCV, they can be given up till 1 year, but only if the first dose has already been received. Then at 9 months, two vaccines are there. First is measles and second is Japanese encephalitis, both first dose. And remember, measles vaccine is given with vitamin A. The measles vaccine can be given up till 5 years, while the JE vaccine can be given up till 15 years. And the other thing is, the pneumococcal booster dose is given. Then 16 to 24 months, second dose of measles and Japanese encephalitis is given along with booster dose of OPV and DPT. And at 5 to 6 years, again, booster dose is given, and at 10 to 16 years, TB is given. Remember, this is an update that initially only TT was given for older children and pregnant female, but now for pregnant female and children between 10 to 16 years, TD is given. Okay. Then the vaccines in a bit detail. BCG, the dose is 0.05 ml intradermal in left upper arm, and it should be given within 1 month. If it is given after a month, the dose is 0.1 ml, right? And it can be given up till 1 year of age. It is a live freeze-dried vaccine. The strain is Danish 1331, and it is used to prevent, sorry, it is used to prevent childhood TB, TBM, then bladder cancer, and even leprosy. Then hepatitis B, birth dose is given. Then it is given at 6, 10, 14. In adults, the schedule is 016, right? Remember, the birth dose is given after 24 hours only because it prevents perinatal transmission, and hence there is no point in giving it after 24 hours. Then at 6, 10, 14, 1 to 3 doses of Hep B is given, either alone or with the pentavalent vaccine. And remember that Hep B can only be given up till 1 year. The dose is 0.5 ml intramuscular and it is given in the right thigh anterolateral. Right, it is a formalin inactivated subunit vaccine. Next is measles rubella vaccine. It is in an amber colored bottle. It is given at 9 months and 16 to 24 months, and it can be given up till 5 years of age. The dose is 0.5 ml subcutaneous in right upper arm, and it is a freeze-dried vaccine. So it is reconstituted with distilled water, and the BCG is reconstituted with normal saline. Then the strain is Edmondson Zagreb for measles, Geranylen for mumps, and RA23 27.3 for rubella. Then the adverse reaction is measles-like rash. Then a rare reaction is SSP. This was asked in the NEET 21, and it can also cause autism, but there is no such research to support it. Then pentavalent vaccine, it consists of DPT, Hib, and Hep B. Since it contains Hep B, so it can be given only up to 1 year of age. Dose is again 0.5 ml intramuscular, and it is given in the right anterolateral thigh. It is a conjugate vaccine, and the adverse effects are there can be neurological deficits due to pertussis component. Hence, it is contraindicated in neuropathies and immunodeficiencies, right? And they can also be inconsolable cry. Then some other vaccines. First is Rotacil. It is 2.5 ml the dose. It is a blue colored bottle, and it is given oral. The three vaccines are Rotatec, Rotavac, for which 5 drops are given, and Rotavec. Right? And vaccine has the components are vaccine, diluent vials, and an adapter syringe. And 2 doses of Rotacil are given. Remember, Rotacil should be kept on ice pack, and if it is open, then it should be used within 4 hours. The side effect is intussusception, which has been asked a lot of times, and the contraindication is if patient has undergone abdominal surgery. Rotacil can be given up till 1 year of age. Next is Prevnar 13. The dose is 0.5 ml and anterolateral thigh, and it is also a new vaccine. Hence, the maximum age is 1 year. The schedule is at 6 and 14 weeks, and a booster dose at 9 months. And remember, there should be minimum 8-week gap between 2 doses. Then the pneumococcal vaccine, it can be either PCV13 or PCV10. The PCV10 has an antigen and a protein which is a conjugate. Remember, the pneumococcal vaccine is given for immunocompromised patients, splenectomy, post-splenectomy, organ transplant, and patient on long-term steroids. And the contraindication is anaphylaxis. Then bivalent OPV contains poliovirus strains 1 and 3, and the switch day was from trivalent to bivalent on 2016, and it is a pink colored bottle, right? Then Japanese encephalitis. Here, 2 doses are given. First is at 9 months and second at 16 to 24 months. The dose is 0.5 ml subcutaneous in the left upper arm. It is a killed vaccine, and the strain for killed vaccine is BG or Nakayama. Remember, the strain that is given is SA1414-2, which is a live attenuated vaccine that is used in our country in our schedule, and this was asked in NEET 21 this year. Then next is IPV. This is the South. It is given at 6, 10, 14 along with Penta, right? And that vaccine is known as Hexavax. Remember, the dose is 0.5 ml IM in the anterolateral right thigh. Now, fractionated IPV, for that the dose is 0.1 ml intradermal, and that is given at 6 weeks, 11 week in right upper arm. And fractionated IPV, age that it can be given up to 1 year, right? And remember, IPV contains all the polio strains. Then DPT, it can be given up to 7 years of age and doses again 0.5 ml anterolateral left thigh. It is a freeze-sensitive vaccine, and remember, it should never be kept on the ice pack. So how do we check it? By doing the shake test. If there is precipitate, then the vaccine should be discarded. While if it is amorphous, then it can be used. The side effects are neurological inconsolable cry, right, due to the pertussis component. Remember, the TT is 2 to 10 Loeffler's unit, the diphtheria part is 6 to 10 to 20 Loeffler's unit, and in adults, the lesser amount of diphtheria component is used, which is less than 2 Loeffler unit, right? Then some other vaccines. Important one is yellow fever. The strain is 17D. Doses again 0.5 ml, and it is a subcutaneous, or it can also be given IM. Then the immunity starts to develop in 7 to 10 days and it lasts lifelong, right? Then meningococcal vaccine, it has ACW135Y. Only component that is missing is B, right? And there can be increased hypersensitivity leading to local erythema. Then rabies vaccine, it is human diploid cell culture vaccine. And remember, Malana reaction with proguanil is associated with rabies vaccine. Then cholera, the two are Dukoral and Sankol. Remember, Dukoral is a subunit vaccine, and therefore gastric buffer needs to be added in Dukoral vaccine, while in Sankol, since it is not a subunit vaccine, no gastric buffer needs to be added. Then in travelers, the vaccine used is Evicol. Dengavirix is a tetravalent vaccine for dengue. Malaria vaccine, it is a circumparazoid protein, and it contains rapid repeat regimen, T cell epitope, and HBs AG. The adjuvant is arsenic oxide. Then leprosy. This is an important question which should be remembered. It is the leprosy vaccine is by the strain Mycobacterium indicus, which is also called as Mycobacterium pranae, right? This was asked. And then the AIDS vaccine is RADV, that is the adeno-associated viral vaccine. And the vaccine names are Ankara and AidVax. Then typhoid, oral vaccine is the Typhi 21A. It is a live vaccine. It can be given after 5 years of age. While in adults or children or immunocompromised patient, the vaccine that is given is a VI polysaccharide vaccine.
So the next topic is unimmunized child. So first of all, when we call a child fully immunized, if he has received all his vaccines till 1 year of age, while a completely immunized is that has received all the vaccines till 23 months. So now let us look at some examples. For example, a 15-day-old child comes to us who is completely immunized. So we will give him BCG, then OPV, 0 dose, and remember that hepatitis B birth dose is not given because it is given only up to 24 hours because it is needed to prevent the perinatal transmission, hence there is no point in giving it after 24 hours. So 1 month unimmunized child will receive BCG only because OPV 0 dose is given up till 15 days only. And hepatitis B birth dose is again not given because it is given only up till 24 hours. Suppose a 6-month-old infant comes, right? And this could be a potential question. So a 6-month-old child comes who has already received BCG, OPV first dose, and pentavalent first dose. Right? So, what will be the vaccines that we should give to him? First is we will give the second dose of OPV and the penta. Remember, the newer vaccines like rotavirus, pneumococcal vaccine, and fractionated IPV, they are given only along with the first dose of OPV and penta. Hence, these vaccines will not be given. Next scenario is an 8-month-old child who has already received OPV 1, rotavirus 1, and pentavalent 1. Now we will give it to him BCG as it can be given up to 1 year. Then, since the first dose has already been given, we will see a gap of 4 weeks and administer OPV2, rotavirus 2 and pentavalent second dose. So, the vaccines are OPV2, rotavirus 2 and pentavalent vaccine second dose. Next question is a 9-month-old child who has received BCG, OPV second dose, rotavirus first dose, pentavalent second dose and IPV first dose along with pneumococcal vaccine first dose. So for pneumococcal, the gap of 8 weeks should be maintained, and for others, the gap of 4 weeks is required. We will give him measles vaccine, measles conjugate or the measles rubella vaccine first dose, then Japanese encephalitis first dose, OPV third dose, rotavirus second dose, then pentavalent third dose, IPV second dose and PCV second dose. Right? So we just need to look at the gap and the age of the child, and then we administer the vaccine as such. Next is a 10-month child who is completely unimmunized. So he will receive BCG, OPV first dose, pentavalent first dose. Then we will also give him rotavirus, IPV and the PCV first dose because it is given with OPV and pentavalent first dose. Now, an 11-month child, so he has received BCG, OPV second dose, rotavirus second dose, IPV first dose. Also, pentavalent second dose and PCV first dose. Right. And JE first dose. So we will give him the third dose of OPV, the third dose of rotavirus, and the third dose of pentavalent, second dose of pneumococcal vaccine and second dose of IPV vaccine. Right? Obviously, we should mind the gap of 8 weeks between the PCV vaccine and 4 weeks between the rest of the vaccines. Then the next question is a 12-month-old unimmunized child comes. So we will give him OPV first dose, DPT first dose, PCV first dose, JE first dose. Remember, pentavalent is given only up till 1 year. Hence, DPT is given. Other like PCV, IPV, BCG, rotavirus, they are not given. OPV1 is given because it can be given up to 5 years, DPT1 up to 7 years, PCV1 up to 5 years, and JE1 can be given up to 15 years. Next scenario is a 24-month child, that is a 2-year-old child who is completely unimmunized. Again, we can give BCG, no. Pneumococcal pentavalent, no. Rotavirus, PCV, IPV, no. Because they all are given less than 1 year, up to less than 1 year of age. So what we can give him is measles conjugate vaccine, Japanese encephalitis vaccine, OPV vaccine and DPT vaccine. Measles conjugate vaccine first dose, JE first dose, OPV first dose and DPT first dose. Next scenario, if a 5-year-old child comes to us who is completely unimmunized, here the measles conjugate vaccine, JE vaccine, DPT and OPV, right? So what are that cannot be given? First is measles vaccine as the child is 5 years, and OPV vaccine as the child is 5 years of age. JE first dose and DPT first dose can be given because JE can be given up to 15 years and DPT can be given up to 7 years of age. So that was all regarding the important vaccines and how to go about problem solving when a child who is unimmunized or partially immunized comes to us or presents to us in the clinic. Hope you find this video beneficial. Do like it, comment, and follow me on Instagram for other series like question of the day, topic of the day, and a new spotter series that I'll be starting on my Instagram channel. Do check it out. Bye bye.